Welcome back to the show. We are closing in now on Father's Day, and we want to make sure Dad is in tip-top shape health-wise. That's our focus during Men's Health Month. And Dr. Christopher Valentine joining us now with Optum to focus on men in this sponsored interview. And since the pandemic, fewer and fewer adults are taking care of their health, and stress levels are rising. And guys, you don't take care of yourself often as much as women do.
Yes, no, unfortunately, it just seems like, especially in my experience in medical practice, that it was a lot more likely for wives to encourage their husbands to come in than the other way around. And I think that a lot of times, a lot of preventative care is missed because men think, oh, I feel fine, I'm doing all right. And there's just some barriers there, I think, in getting some of that preventative care.
So Men's Health Month, is in June.
Yes.
It's this entire month, so the perfect time to focus on these issues. So why, guys, should you take this so seriously?
Well, because we really, at Optum, we have a big focus on prevention. And so really the best way that we can try to get ahead of cancer, get ahead of mental health issues, get ahead of other cardiovascular concerns like hypertension is just ensuring that we're reviewing just healthy lifestyles for one thing, but then also ensuring that you're engaging with a primary care physician.
Should we talk about some of these percentages when it comes to men's health? 15% of adult men are in fair or poor health. 52% have hypertension. 41% are considered obese.
Yes. And it just seems to be the trend is going in the wrong direction, and really a combination of active medical intervention and, like I said, healthy lifestyles really need to be engaged. And so really having these conversations with men, I think, is very important.
Okay, when you say healthy lifestyle, what are some tips for men out there watching?
Well, you know, the first two things, of course, are going to be diet and exercise, and you always hear that. But what we're really talking about, even with exercise, even as little as 20 minutes of exertional activity 3 times a week will make a huge difference. I think a lot of times people feel like, well, I can't get to the gym, I can't do this, and I don't want to go all out. But just a little bit will go a long way. And then as far as diet's concerned, really just looking and examining and saying, are there ways that we can improve and increase the amount of unprocessed plant material in our diet? You know, getting more than 50% of our calories from a plant-based source is a good place to start.
Doctor, how do you feel about the quick fixes that are out there right now that so many people are talking about?
Right, there are definitely a lot of people that are willing to take your money. There's a lot of really seductive ideas about, you know, you just need this supplement or this powder or this thing or that. And I'm not saying that there isn't some importance there in examining some of the things that are out there, but I am saying that you need to start with really the basics and ensuring that you're getting the right kinds of screenings and that you're getting the right kinds of habits in your life.
And I think it's important, you mentioned earlier, health exams are not just for when you are sick. They're for when you're well.
That's right. And unfortunately, a lot of times the first time we see patients is, you know, after an emergency room visit or after a hospitalization. And we want that first time to be with their primary care physician, when you can look and see, for my age, what kinds of screening tests do I need? When do I need to be screened for colon cancer? Well, the answer is after age 45. When should I be screened for prostate cancer? Well, that can be a little bit more complicated, and you should have a discussion with your physician about your own individual risk factors and whether that's the right thing for you.
So don't be afraid to ask questions when
Yes.
you go in and see your doctor. Don't just say, am I doing great? Right? Go further, dig deeper.
That's right. You should be prepared and kind of have some of those questions. And I know that a lot of times physicians are really busy, but really within Optum, we're trying to ensure that there's enough space in that time with your physician through the way that we really try to focus on prevention and outcomes instead of just focusing on just being reactive to that.
What's so great about Optum, too, is they have this mobile clinic, so you make it easier for your members.
That's right. Yeah, we have this big orange bus. You can't miss it. We drive around and we'll partner with different health systems in order to perform different health screening tests and whatnot in cooperation with your physician.
Look how cool it is inside.
Yes. Yeah, we're able to do cancer screenings, other kinds of health screenings. We have a mammography for women, and really the intent there is to just have that focus on prevention.
I saw you in that at the parade over
That's
the
right.
weekend. So
Yeah.
you take it on the road sometimes.
That's right. Yeah, we had it out there for Pride. If anyone was able to see us there, we had it all decorated, but that was a great experience.
Great team there at Optum, everybody. If you'd like to know more, optum.com/Utah, and go to our website for a link. And our thanks again to Optum for sponsoring that interview and sharing important messages about Men's Health Month. We appreciate seeing you.
Hey, thanks so much.